Thanks, Dan. You can see my title slide, and I think we end up here with the bottom line. This is a challenge, a major challenge that we've been discussing and seeing some of the issues. Next slide, please. The one thing that I think is important is we've got some critical questions when we get into this non-occupational use, and also the big one is the public, is who do we provide protection? What is this group of people? And I think this morning we noted we were dealing with generally respirator approvals were with healthy workers. But now when we go to the general public, we see we have children, we have an at-risk population, and certainly Dr. Holmes' presentation yesterday gave us some insight on infants and young children. We have the elderly and the physically challenged, immune compromised in this group of public wearers that have issues that we need to think about. The next issue is, what's the hazard? I think we've really, in my mind, struggled as a country and as an informed user with the COVID is what is the hazard? But more broadly, over the years, we've seen chemicals be an issue with spills, pesticide spray, lead from leaded gasoline. The picture on the right gives you an idea of air pollution, which brings in smog issues, ozone, particulates. We're talking, and this is focused on wildland smoke, which is another big area that needs to be addressed, especially here in California. Biological agents, we've heard about mold over the years. And of course, now we're all focused on the Corona-19 virus. One thing I'd like to introduce now, and I'll talk a little bit about it later, is what's the source? And that's kind of me, that was always a basic industrial hygiene topic that I think we haven't emphasized as much as we should with the COVID. The next topic is, how do we provide this support? Certainly the hierarchy of controls has been looked at, and so we discuss engineering controls. You'll hear discussions about ventilation systems, HEPA filters, electrostatic filters, more air changes, larger volumes to kind of deal with controlling or diluting this source. Administrative controls have been not played much, but 6 feet. Distancing is an administrative control. Small gatherings, another example of an administrative control. Stay out of small bars with boisterous people. And then we come to personal protective equipment, which in the past has been referred to as the last line of defense, the last resort. And here we are in a major focus on personal protective equipment. Next slide, please. So if we focus now on what is a respiratory protective device, which is a form of personal protective equipment, I believe it's important to realize that this device is designed to provide the wearer with a specified level of protection against a defined hazard. So we move through and you can see that we have NIOSH and FDA define the conformity assessment, and OSHA defines the elements of the respirator program to provide the protection for the respirator. Masks can be PPE or they aren't. FDA has a series of 2 different kinds of masks, surgical, non-surgical. And then as Jeff noted this morning, we're entering into a facial covering product development or set of standards to better define it. On the next slide, I've shown some examples of RPD. And it's important to note these are all NIOSH approved. They will pass the fit test requirements, but the one in the bottom center with the funny little button in the front has an exhalation valve, and we've heard discussions about exhalation valves. And the one thing I want to introduce that all of the industrial hygienists will understand is this is an impactor. I've heard nobody talk about that yet, but impactors are designed to remove particles when an airstream comes in contact with them. So when the valve opens, it will naturally remove some of the particulate, the droplets, especially the big droplets that may come out. But more important in this whole discussion of COVID is, what is the source of the infection? And I've heard nobody say it's people. So when I see a person driving in his car by himself, all decked out with a mask and wondering what's going on, does he understand there's no source of COVID he has to be concerned about? Or whatever. And so I think the importance of educating the public on sources and the need, when you need the protection, is to put the mask on and the barrier and not get too excited in places or go through the inconvenience of wearing a mask when there's no source to infect you. So I think that's something that we've failed in the education process. The next slide shows us examples of facial coverings. Jeff again mentioned that we're going to try and deal with the 3 masks on the right as facial coverings of different designs and innovations and see what we can come up with a standard. The one in the center for everybody's historic interest is called a comfort mask. For those who don't know, this is a pre-N95 respirator. This popped up in the 60s and was modified and upgraded to give us the N95 or the filtering face pieces we know today. The 2 masks on the left are surgical and non-surgical. FDA has some oversight on those that provides performance criteria for their protection. Next slide, please. So what do we need for an effective respirator protection plan? Well, I think key in this is the assigning of the responsibility for overall program to one organization with authority to delegate where appropriate. Could be government, could be private sector. I'm in favor of NIOSH because they have the history, the skills, and the knowledge to move it along quickly. We need to develop an education program for the general public. Certainly, we've heard discussions about knowing the difference between a respirator, a mask, and a face covering is pivotal in understanding how to use them and be comfortable with the level of protection they provide. We certainly need to evaluate, quantify, and communicate the hazards and risks clearly and accurately. Been just a terrible understanding of droplets and particles and how does this really impact the risk and the hazard to the individual. And we certainly need to develop consensus standards for this equipment. Emil and John's presentations will cover that. Next slide. The IOM reports I've listed here provide a rich source of information. And Dan, I am watching it, so you know. So these are important, and there'll be great reference documents. And you can see 2006 to 2019, various parts of this topic have been addressed. We'll pass the next 2 slides, if you would pass that one, and on to the challenge. Okay, the challenge to me is to develop the development of a conformity assessment program for respiratory protective devices and other PPE for civilian use. Needs to be assigned, as I noted before, to one organization, and they can delegate as appropriate. This separate or integrated conformity assessment program for RPD and other PPE used by a public should follow the successful NIOSH and OSHA model. And we don't want to forget that those two models have been very successful. A major challenge is the development for the identification and characterization of the hazards and quantification of the risks so the public understands what this RPD or other PPE is to be used for. Done, Dan.